Black cohosh, scientifically known as Actia racemosa or Actia macrotis, has gone by many names in different cultures since the beginning of its use. Notably bugbane, because it was once used as an insect repellent, snakeroot, as frontiersmen had said that it was useful for rattlesnake bites, and black snakeroot, for which it was first listed as in the U.S. Pharmacopoeia in 1830. Black cohosh was first used for medicinal purposes by the Native American Indians, who used it to help relieve menstrual cramps and menopausal symptoms. Upon European arrival in the Americas, the natives shared this knowledge, leading to black cohosh becoming a popular treatment for women's health issues in Europe in the mid-1950s.
The oral form of black cohosh is used to treat menopause symptoms, induced labor, PMS, dysmenorrhea, dyspepsia, anxiety, fear, sore throat, cough, mild sedation, breast cancer, cardiovascular disease, to improve cognitive function, infertility, osteoarthritis, osteoporosis, and rheumatoid arthritis. The topical application of black cohosh may also be used for the treatment of acne, mole and wart removal, to improve the appearance of skin, as an insect repellent, and also to treat rattlesnake bites.
Populations have suggested that black cohosh is effective to treat breast cancer, cardiovascular disease, cognitive function, infertility, labor induction, migraine headache, osteoarthritis, osteoporosis, and rheumatoid arthritis. However, there is no reliable evidence for these claims. The German FDA has approved the use of black cohosh for relieving menopausal symptoms, but the US FDA has not. There is some evidence that Remifene, a commercial black cohosh product, can reduce menopausal symptoms. However, not all black cohosh products provide more benefits compared to the placebo.
There is a lot of variability in the clinical trials and results cited. Some clinical research has compared conjugated equine estrogens like Pumarian, low-dose transdermal estradiol like Estroderm, and black cohosh in reducing menopausal symptoms after 6 months of use. There are some studies that suggest black cohosh can work similarly to conjugated estrogens. However, there may not be significant differences among the placebo groups. A few studies published in 2013 show evidence that the black cohosh reduced the symptoms of menopause when compared to a placebo. The woman utilized black cohosh for 8 weeks. In summary of using black cohosh with other products like St. John's wort, the results are inconsistent. A few studies have linked the combination use of St. John's wort and black cohosh extract to the reduction in psychological symptoms related to menopause and changes in FSH, LH, total cholesterol, LDL cholesterol, HDL cholesterol, and triglyceride levels.
Overall, the preliminary clinical trials and research suggest that black cohosh extracts or dosage forms available can reduce symptoms related to menopause, but further higher quality randomized controlled trials do not show significant evidence.
Most side effects experienced are mild and short-lived. The most common potential risk with black cohosh is that it can cause an upset stomach. Other potential side effects include rash, headache, dizziness, weight gain, heaviness in the legs, cramps, breast tenderness, vaginal bleeding or spotting, hypotension, tiredness, and irritability. These risks mostly happen when black cohosh is taken in large doses over 500 milligrams. There is also some evidence that this supplement has the potential to increase the risk for breast cancer, kidney transplant rejection, and liver disease. This supplement should not be taken continuously for over a year, or else there will be an increased risk for all of the things I mentioned.
Black cohosh has been found to moderately interact with the transporter OATP2B1, which is a transporter of the statin drugs. Specifically, it interacts with atorvastatin and reduces the effectiveness of the drug. A moderate drug interaction has been found between cisplatin and black cohosh. It has been found in animal studies to interact with the effectiveness of cisplatin by decreasing the toxic effects that the drug has on breast cancer cells. Further, evidence has been shown that there is a possible moderate interaction between hepatotoxic drugs, for example acetaminophen or carbamazepine, and black cohosh that could potentially cause liver failure or possibly autoimmune hepatitis. Caution must be taken when advising patients about these interactions because there is limited evidence to support them, and further research needs to be completed. Another drug interaction to be mindful of is with cytochrome P450 2D6 substrates. This is categorized as a moderate reaction with black cohosh because of the possible inhibition of drugs metabolized by CYP2D6 in the liver. Examples of drugs metabolized here include amitriptyline, metoprolol, ondansetron, and paroxetine. One final drug interaction is with organic anion transporting polypeptide substrates, commonly referred to as OATPs. Research suggests the substrate OATP2B1 may be inhibited by black cohosh, reducing the bioavailability of drugs that act as substrates for OATPs. These drugs could include fexofenadine, fluvastatin, and rosuvastatin. It is important to realize that research on black cohosh shows inconsistent findings and to take caution with its use.
Black cohosh is not a hormone replacement therapy and should not be thought of as a potential substitute for estrogen. It is not an herbal estrogen, but can act similar to estrogen in some people. Some oral products with black cohosh extract show preliminary clinical evidence of reducing menopausal symptoms. Practitioners and patients should know it is not recommended or tested for pregnant or breastfeeding women, women with breast cancer, endometriosis, kidney transplant patients, and liver disease patients.